Thank you very much for the opportunity to speak on the Brit Punjabi platform, and I'm looking forward to its development in the years ahead. So my name is Ranjit Thaliwal. I'm born in Leicester, Sikh heritage, family originally from Punjab. I'm a specialist lawyer in the area of mental health, been qualified for more than 30 years. Firm is called Welford Solicitors, recently rebranded. Previously it was Thaliwal Solicitors. And so our work encompasses representing those who are detained in hospital by force under section, effectively covering hospitals all over the Midlands area. So essentially that's what we do day to day based in Leicester. I think in my family, as many families were when they were, my dad worked in a manual situation. He worked in a steel foundry. I was the first person from our family to go down the sort of graduate route. Law became interesting because I was quite focused on English. I enjoyed that in terms of speaking. And then there was a program, actually, an American series called Petrocelli, as an American lawyer program, and I really enjoyed that, and that sort of got me into it. So my original passion was to become a lawyer and be a criminal lawyer. And in fact, that's what I did for more than a decade, some time ago, before moving into this specialism. I think mental health issues have been a little bit underground in the past. There's more awareness about it now. People have mental health issues in life generally of a milder to a severe level. We represent those who are got to a situation where the authorities and the doctors feel they must be brought into hospital by force. So it's a very serious decision to bring somebody from the house or from a public place into a psychiatric unit. When they're in that psychiatric unit, they obviously have the right to challenge that, to say, listen, I don't need to be in hospital. I want to be home. And the court effectively comes to the hospital. Normally you go to the court for other cases, but here the court comes to the hospital, the tribunal comes to the hospital, and they have a hearing to decide whether that person should still be detained or can be discharged. Living in Leicester is a big BAME population across the board. Diversity is the bedrock of Leicester. And obviously when we represent those people in the Midlands and in Leicester, we get individuals from many different backgrounds, clearly from the Asian background also. I think there's general issues in life which affect people's mental health and bring them into a difficult situation. I think the examples that apply to everyone are just big life events. And what I mean by big life events, suffering a major bereavement, matrimonial separation, issues around finances, issues around drugs use, issues around self-esteem, issues around abuse or mistreatment at an early age. So a lot of things can happen, and they can be there in the background across any community, And I think then there's particular things which affect the Asian community, which I can sort of talk about separately. The things that I found through my experience that are important is, first of all, mental health's got a little bit of taboo. There is a concern about it. There wasn't the understanding about it. People were scared of it. There's quite a famous poster by Mind going back to 1980. It's the same photograph, a person sitting on a chair, and he's got a fractured arm. It said, when I had a fractured arm, everyone came to visit me. He's surrounded by people. Then there's the same photograph, same person, and it says, when I had depression, nobody called me, and he's by himself. So it's a different response to sometimes to mental illness as opposed to physical illness. Physical illness, the response is usually very, very strong. And I think there's other factors that lead to that. The Asian community in the past, I think, may be a risk if someone's falling unwell. Rather than reach to the services, the family comes around and locks the situation into the house to keep it maybe low key, to keep it private. And then that means that when the problem reaches its peak, it's bigger because it was delay. There was a delay before you reached out to the services. Whereas if somebody reached to the services quicker, you can try to prevent the breakdown being major. So I think there's differences around that. Now there's a lot more openness. There's some brilliant national charities out there that do work. You have Mind, you have the Samaritans, etc. Locally as well, there can be advocacy groups which have some Asian experience in there. There's a group in Leicester been established for a long time called ADAR, the ADAR group. They're based on St Peter's Road, and they have some specialism around that. So I think that helps. The barriers that are particular to, say, the Asian community can be around language, number one, misinterpretation, people taking things the wrong way. There can also be around mistrust of services. And if the services don't reflect anybody from the BAME background, the mistrust can be higher. But now, thankfully, there's much more BAME representation through the doctors, through the social workers, through the community team. That helps to overcome the problem. I think it's always good when there's dates in the calendar to raise awareness. Only good comes out of that because people get to find out what the resources are out there. I think number one is the community should be open to sharing. Turn to the authorities. There are resources there, and the point is when somebody hits that patch in their life which is difficult, it's all about keeping it on a level rather than it getting to some stage which is far more progressed. So the main message I think is number one, if you're the person having the mental health problem, share your problem, discuss with the nearest and dearest, turn to professionals. On the other hand, and this is equally important, if you have a friend or family member that you feel or know is getting into problems, reach out to them, help them, speak to them, confide with them, because I think that scenario of support is really important. It's a two-way process. We deal with the harder end, so we have a mental health department and court protection department as well. So we have two distinct departments. Our mental health department, we go to those in hospital, see them there, about the appeal, about wanting to come out of hospital, support them in that process. The hearing can take up to 2 months. Some hearings can take 1 week.